All right. Okay. So we'll be debating, but at the end of the day, I know I'm going to be winning. But let's just start with the vote from the house. How many of us is 60 plus and you use WhatsApp in this room? Right. See. How many of us has somebody at home who's 60 plus and they're using WhatsApp? So I mean, I'm winning, right? Well, the question is aging with the role of technology. So does technology help improve the quality of life when a person ages? Now, in today's world, we are talking about something called longevity, which means living longer with more comorbidities. So the question of having a better quality of life comes. Yes, we know technology can sometimes act as a burnout. It can sometimes increase your distress, but everything too much is bad. But if you use it in a structured, in a directed way, with simplified interface, then can it really work? So now see, everybody here in this house will have an opinion that yes, it may work, yes, it may not work. So what I will do over my next allotted 15, 20 minutes is just show you scientific evidence. 8.5 minutes. Oh, sorry, 8.5 minutes. I'll give you scientific evidence. I'll be fast. Don't worry. And we'll let you all decide. All right. Disclosures, nothing much to say. So now where is the need gap? So we are looking at around 589 million people living with diabetes, metabolic conditions. The prevalence in high India itself is looking at 90 million people. Projected population, people living longer, there's going to be 2.1 billion people over the age of 60 in 2050 living with diabetes and other chronic metabolic conditions. So this is like a storm. It's a metabolic storm, and this particular storm is more in the geriatric population also. So when now we are looking at GLP-1s, SGLT hitting the disease hard and early, we are looking at people benefiting from that and living with lesser to moderate degree of comorbidity over a period of time. Also, there is a booming digital health market, not just across the globe, but also now in India. And today we are talking about digital health, we are talking about artificial intelligence. Just coming week, the next week, we are having the India AI Impact Summit in the global south. And we are all looking at adoption of digital health to solve some need gaps and problems. So, can it really improve our geriatric aged population? So, I'm going to give you 7 pillars and I'm going to justify on that. Glycemic monitoring, CGMS, and wearables. Does it work? Remote care, diagnostics in terms of screening and prediction, drug innovation, cognitive protection, independent living with the smart homes and assistive robots, and the biological age measurement. Let's look at one by one. Now, CGM, we have all looked at the entire population, but if you look at certain studies that speaks about CGM in the elderly, this is one of the paper that looks as 47% reduction in hypoglycemia, improvement in time in range, and adherence is not bad. Just because it's technology, it doesn't mean a person with a cognitive impairment will not be comfortable using it. So this is a study that kind of disrupts this myth completely. Couple of more studies you see on the screen, and this goes on to say in people studied with a mean age of 71 years, there was 2.3% reduction in hypoglycemia. It benefits seen in both CGM naive and in existing CGM users. And if this is the benefit, looking at the long term outcomes, it is cost effective. Couple of more evidences you see on the right, and the literature is all there, and you'll all have access to it at the end of my talk. It speaks about the replace trial that has 56% reduction in hypoglycemia in more than 65 age group of people. So CGM don't just improve number, they save lives and money. And this is something which is needed when you're looking at the long-term control of diabetes. So that is for wearables and CGM. Let's look at another wearable using the Apple Watch. And when I did the research on this topic, I was surprised to see so many meta-analysis on this topic. This speaks about detection of atrial fibrillation, which is often paroxysmal and one of the cause of hospitalization and sudden cardiac death even before the stroke happens if you have a wearable technology like the Apple Watch. And that is fantastic. And it improves the quality of life and reduces hospitalization and mortality. These are the RCTs. More than 240 RCTs confirms that telemedicine works for the elderly people. I've just quoted you one paper, but the reference of literature will give you many more RCTs that speak about, and we have all experienced this during the COVID times as well. Well, now you may say not everybody has access to internet and access to mobile phones. I will not agree that we don't have access to mobile phones. Even anybody living in a rural world, in the rural Indian setting, also has a smartphone. Let's presume then they don't have or have access to internet. We have seen that there is improvement with even SMS interventions. 0.42 reduction of HbA1c. Metformin reduces by zero point 0.5 to 0.7%. So, what's the harm of using technology? SMS intervention itself can work. And these are some of the paper and a very effective and a robust looking paper that was published in the Lancet that looked at the effectiveness, reach, and uptake and feasibility of digital health interventions with people with type 2 diabetes, which had a major percentage of people in the elderly age group. So, remote monitoring can improve hospitalization in the elderly multi-orbit patients. And this is something which has been seen in this particular study, the IPOCA RPM study that looked at 50% reduction in unplanned hospitalization and visits to the emergency department. This is something that you all must have heard of, the e-Sanjeevani platform of the government of India, which is truly a remarkable platform. If you're working in public health, you would know how this is working. And it has more than 12% people who are senior citizens enrolled onto it. So that kind of takes away the myth that elderly people cannot use. The whole concept of Ayushman Bharat, the digital mission led by the National Health Authority, actually empowers not just the chronic metabolic population of the country and the NCD population, but especially the elderly population to access telemedicine platforms right with the help of remote care from their home. In the US, telemedicine saves billions of rupees in the market, especially in a country like India where cost of the treatment is out of pocket. We must consider options like this. So technology does not only improve outcomes if used in the right way with the right simplistic user interface. And again, say the word simplistic UI because that's where the hurdle is. It can improve the quality of care. It can also reduce the cost of care, especially in a country like India. We just have to devise the scientific evidence for adoption to it. Now, this is something we all know. We are all, many of us are using it. I've been using it for 8 years in my clinic, AI-based retinopathy camera with fantastic sensitivity and specificity. Again, for your patients who doesn't need to visit the opthal just for a screening, you can do it on your clinic, especially the elderly and the geriatric population. And nowadays, the cameras are also sensitive that even if a patient has a grade 3 cataract, it will be able to screen it. Likewise, for foot ulcer with recurrence of 93% of accuracy. Polypharmacy is a big challenge in our elderly population, and many patients end up in the hospital because of polypharmacy. And you can prescription, most of the time, it is a repeat prescription and it is by automation. So, this is a thing which technology can solve. And again, a paper that looks at the polypharmacy problem and how it can improve the outcome in patients who are on chronic medicine. AI can predict falls with 94% accuracy using just a smartphone. These are the papers which I have referred to, especially in individuals with osteoporosis and frailty. It can impact their quality of life by improving chances of fall. I'll leave you with a couple of very interesting literature look at. Now we are looking at GLP-1 across the spectrum, right? There has been papers that looks at GLP-1 possibly improving the risk of Alzheimer's disease. And these are a couple of papers that I've looked into, and it's not a foolproof concept, of course, it's a proof of thought. But there is emerging evidence that semaglutide is associated with 40 to 70% reduction in the first time of Alzheimer's diagnosis. I'm sure as the drug evolves, we'll get more and more pleiotropic benefits of these GLP-1s coming out. But then again, this is one of the place to look at. So, prevention versus treatment, as we head into more precision medicine, into more patient driven medicine or patient centric medicine, we are looking at more preventive health. And we are looking at more longevity induced medicines. And this is where technology can come. Can it improve cognition in elderly? This is again a study that looks at digital health technology interventions for cognitive functions in the older adults. Again, a systematic review that looks at improvement in attention, executive function, and working memory as well. A few last slides. Again, this is another interesting paper that looks at 10 weeks of brain HQ, which is under the enhanced trial, which has said that it's improving the brain function as well. But again, these are early days, but there is evidence if technology is used in the right way, it can improve the quality of life with aging. AI detects cognitive decline through speech and digital biomarker. And this has been published in NPJ Digital Medicine with speech based digital biomarkers. And these are some of the futuristic tools which can be enabled in the smartphone. And of course, the smart homes in people who are living alone, where children are living outside. And this is where you can actually make use of technology by giving them a better quality of life. And there are evidence, whatever I'm talking about is scientific literature review evidence. Lastly, epigenetic clocks measuring how fast you're really aging. I mean, if this can be even predicted looking at the circadian rhythm and the biological clock. So, this is also a part of work which has been done. So, yes, we have technology which is very powerful. We have AI, we have agents and agentic AI today, all in our smartphone. If you can resurface this with the evidence based medicine that we practice, then technology can kind of break all barriers and change the way we practice medicine. We have seen remarkable improvements in COVID-19 period as well. A few counter agreements that my colleague will say: a digital divide, privacy and data, over reliance and technology. Well, you can see the realities which I have just said. In terms of privacy, the DPDP Act, I'll request all of you to go back. Yes, just the last couple of slides. I'll request all of you to go back and look at the DPDP Act, which kind of tells us that we are looking at technology driving medicine, AI at the intersection of medicine. These are all the robust evidences which I have just enumerated to you all. You can take a snapshot of this. And if you don't want to work hard, I'll give you an easier way of getting the entire content. So I will end to you all by saying this important thing that the question is not whether technology helps aging, but how fast and scientifically we can scale it, because it's a wonderful technology. AI technology, digital health is out there, but we have to use it effectively with the scientific evidence. These are all the literatures. And now lastly, use your technology. Take a QR code scanning of this will give you access to the entire 8.5 10 minutes presentation which I have given to you, and you can read and comment on your own. And at the end, I would like to invite you all on behalf of Doctors AI to join us in the Doctors AI Global Summit 2025, where we talk about a lot of AI and digital health improving patients' life in September this year in New Delhi. Thank you so much. I'll be happy to hear my colleagues' viewpoint and then a quick